Dr. Hope Reyes. I am a pediatric physical therapist and certified breastfeeding specialist.
Hi, I'm Karyn Johnson-Fernandez, pediatric occupational therapist and feeding specialist.
And we have created comprehensive and collaborative tongue-tie therapy in San Diego.
We hope you enjoy the videos. Let us know if you have any questions and give us a like, a comment, or subscribe. Thanks.
Bye.
Sleeping tongue pose. When your baby is sleeping, check to see if their mouth is open or closed. If the mouth is open, gently come towards the chin, push the chin up so that you close the mouth. After holding the chin for a few seconds, pull down on the chin to ensure that the tongue is up in the palate. If the tongue is not in the palate or if it loses suction, gently remove your finger, close the mouth again, move your finger back to the mid-blade portion of the tongue, which is behind the chin. Hold for a few seconds, bring your finger back to the chin, and gently pull down to ensure that the tongue is up in the palate. This works for optimal sleeping oral rest posture. So this is the sleeping tongue pose. When the baby is sleeping, make sure that their mouth is closed. And once they're settled, you can use your index finger to pull down on the chin to see if the tongue is up. If the tongue is not up, close the mouth, gently slide your index finger back behind the chin and give some input for a few seconds before trying to pull down on the chin to see if the tongue is up in the palate. The tongue was up and lost suction, so you can close the mouth and try this again 1 to 3 times in a session. The tongue is nicely up in the palate, and you can hold this for a few seconds to see if the tongue stays up. Okay.